welcome to the Excel Nursing Academy. This is your mentor Anshika, and I want to firstly extend a very big congratulations to all the students who have cleared their NORCET pre-exams. And if any of you are apprehensive of how to clear or crack the NORCET Mains exam, then you have landed to the right video. This is a step-by-step guide for all the students of how to clear and crack complete NORCET Mains exam. So first thing before dwelling onto the video that I want to instill in all of the students that are watching this video is that you deserve the NORCET Mains exam. You shall not be underconfident in your abilities. Why? Because see, amongst 62,426 students who appeared in this exam, you are the 35,000 students who have qualified this exam, and then 7,829 students who were called for the NORCET 7 stage 2 exams. So you are already 12.5% of the students among this whole 100% of the students. You are the cream. You deserve this NORCET 7 stage 2 exam. You deserve cracking this exam. You shall not be underconfident right now. So you have already qualified this exam and you have to develop the confidence in you. So with this being said, let's move on to step-by-step approach of clearing your NORCET Mains exam. So firstly, very important in the mains exam is to manage your time to practice the mock question papers. So we know that the NORCET Tier 2 exam has a different pattern. There we have 180 minutes and we are given 160 questions in 3 blocks. So the first block is of 45 minutes and similarly the other 2 blocks are also of 45 minutes. And each of them has 40 questions. So if you are doing this block, say in the first 40 minutes, then you cannot jump to the next block in these 40 minutes. In these 40 minutes, you only have to do this. After these 45 minutes have been gone, then automatically you are brought to the next 40 questions. And in this, you cannot jump back to see the question that you have done were correct or not. You cannot edit these questions. Now you are in this block. After this 45 minutes have ended, then you move on to the next 45 minutes and the next block of questions, and then you cannot go back to any of the previous blocks. This determines your success rate, how well you perform in each 45 minutes. As there is no going back to the previous 45 minutes that you have passed, so time management is the key, is the catch here. And how will you manage your time? Firstly, what you have to do is analyze your prelim experience and adjust accordingly. So take out your prelims exam paper and then see what were your strength, what were your weakness, how well you did that exam, and what questions lead to the wastage of time. See that what are your strength, weakness, note them down and practice towards them. Mimic the main scenario. Take a table and a chair, sit down, take a mock test paper, divide the questions into 40 questions and take a timer. Sit by dividing time into 45 minutes. Do not go back to the previous 40 questions. Mimic the complete main scenario and then solve it. These practicing of mock tests under time condition will make you familiar with the exam structure and will improve your pacing for the mains exam. And then you have to practice previous NORCET Mains question paper to understand the type of question that are asked. Obviously the NORCET pre-exam is just a qualifier, so you will get more easily conceptual question, while the NORCET Mains is a more deeper understanding paper. So you will get a lot of scenario based clinical questions. They will want to see how well you will perform in the clinical scenario, how well you will use your critical thinking, which bring us to our second step, refining your critical thinking and clinical judgment. So in the clinical setup, how will you use your critical thinking to save the lives of the patient? This they want to check. And how will they check this? By scenario based questions. So scenario based questions, you have to focus on these questions and solve. And 2 more important books that you need for focusing on scenario based questions is NCLEX RN examination book and your MOSB. Practice all the NCLEX type question to improve your critical thinking skills. For that, we have one example that you are a community health nurse working in a rural area with limited healthcare resources. You are tasked with educating a group of women about family planning methods. Which of the following method would be most appropriate to recommend to these women considering their limited access to healthcare facilities and potential cultural sensitivities? A. IUD insertion by a healthcare provider. B. OCPs obtained through a local pharmacy. C. Condoms available at a nearby health center. D. Fertility awareness methods taught by a community health worker. So you have to guess the right answer, which is D, fertility awareness method taught by a community health worker. You will have to guess this. If you answer it incorrectly, it's because you did not read the keywords correctly. The keywords were limited access to healthcare facilities and potential cultural sensitivities. So limited access to healthcare facility will tell you that IUD insertion and oral contraceptive pills, these will not be feasible for them because they require access to the healthcare providers and a consistent supply of medications. So they do not have access to that. And then cultural sensitivities. Condoms is also a viable option, but their availability, their cultural acceptance will be a barrier. So the cultural insensitivities tells you that. So we are only left with the fertility awareness method, which can be taught to these workers because that do not require any ongoing medical intervention, making them accessible in the areas with limited healthcare services. This was a scenario based question, and that's how you have to read a scenario. That's how you have to use your critical thinking and handle this. Read the question very carefully. See what the question is trying to ask you and what is the right thing that you have to do in this scenario. The third is prioritization and delegation questions. Be prepared to answer the questions on patient care prioritization, delegation of task and emergency response. These priority based questions, you have to either answer it through the Maslow's hierarchy model, or either through ABC or through infection control guidelines. All of these you have to remember when you are doing the prioritization and delegation questions. So we have an example here that a nurse is caring for a patient who has just returned from surgery. The patient reports pain at the surgical site, nausea and an inability to urinate. Which of the following actions should the nurse take first? A. Administer prescribed antiemetic for nausea. B. Offer the patient assistance to the bathroom to try and urinate. C. Assess the patient's vital sign and surgical site. And D. Administer prescribed analgesic for pain relief. So the correct answer in this is to assess the patient's vital sign and surgical site. See, when you get a patient from the PACU, or when you get a post-operative patient, firstly what we do is quickly assess the patient's vital sign and surgical site. Now you will get this answer is the nurse should first assess the patient's condition to determine if there are any complications from the surgery such as bleeding or infection before addressing the common complications of the surgery, that is your pain and nausea. So vital sign will help to identify immediate issues, and then you can prioritize other intervention based on these immediate issues, because the priority is your temperature, pulse, respiration and BP, and then is your fifth vital sign pain and the rest. So with this the correct answer is to assess the patient's vital sign and surgical site. This is how you have to solve a priority based question. Third is to focus on high yield areas. High yield areas means which have a probability that they will be asked more. Then is your image based question. You have to see images of equipments, instruments that are used very commonly in critical areas, LMAs, ETCO2 sensor, all of those things you have to see and keep them memorized well. Then another type that is being asked commonly is select all that apply question, or as we call this SATA questions. Select all that apply questions are tricky. So how you have to do them? First strategy is to read carefully. Focus on the key concepts and look for important words like best, priority, correct, etc. and evaluate each option. You have to treat each option as true and false based on the question. You have to treat it as an independent answer. Okay, and then avoid overthinking. Stick with your initial choices, avoid second guessing, and use prioritization tools. What are your prioritization tools? As I said earlier, your Maslow's hierarchy model, the ABC, airway, breathing, circulation, and the infection control guidelines. Then watch for absolutes. Avoid choosing options with word like always or never unless justified. Watch for them. So we have a question, SATA question here, that the nurse is caring for a patient with heart failure. Which intervention should the nurse include in the care plan? Select all that apply. First, administer prescribed diuretic as ordered. Encourage a diet high in sodium. C. Monitor daily weight. D. Limit fluid intake to 500 ml per day. And educate the patient on low sodium diet. So the correct answer here is 1, 3 and 5. So we read that treat each option as true and false based on the heart failure guidelines. So option 1 was diuretic help remove the excess fluid. So option 1 is true. Option 2, sodium increases fluid retention which worsens heart failure. So option 2 was false. Then option 3, Monitoring weight is essential for assessing the fluid status, so 3 was true. And fourth was fluid restriction is typically around 1500 to 2000 ml per day, not as extreme as 500 ml unless it is specifically ordered, so that's why it is false. And option 5 was true because low sodium diet is important in managing the condition. So then the correct answer is 1, 3 and 5. Moving forward is your sequence, order or rearrange questions. Rearrange questions are also very commonly asked, and the trick again is to read the question carefully, pay attention to the words like first, next or priority, and then visualize the process. Mentally map out your process from start to finish. Look for clues like the initial or finally. Look for all these key phrases that will indicate what is the order. For instance, we have an example that arrange the following steps of administering an IM injection in the correct order. And then we have insert the needle at 90-degree angle, clean the injection site with antiseptic, aspirate to check for blood return, wash hands and put on gloves and administer the medication. This is just an example. Most of you will be getting this right. The correct order is to 4, 2, 1, 3, 5. First of all, you will wash your hands, basic hygiene, and put on gloves. Then you will clean the injection site with an antiseptic wipe as you are preparing the site for injection. Then you insert the needle at a 90-degree angle, initial step, then aspirate to check, which is a safety check, and then you have to administer the medication, which is your final step. So this was a rearrange question or a sequence or an order based question that is also asked frequently. The last is your smart study technique. Study smartly. Do not try to mug up everything. After clearing review your notes and material. Do not go into any of the new things that you want to study right now. Review your notes, materials, identify your weak areas from the pre-exam, and create a study plan with realistic goals, because the time we have left is very less. So we want to create realistic goals and allocate time for each subject and stick to your schedule. So consistency is must. Stick to your schedule that you have made and you will do good. So all the best for your NORCET Mains exam. This was a brief step-by-step guidelines on what you have to do in order to crack the NORCET Mains exam. I hope you all will do your best and give it your 100%. So we are also on Instagram. Kindly follow us there. Do share our videos. Do follow us for all the new nursing updates. We also have our WhatsApp group where we post daily quizzes and daily vacancy updates. All day we post image of the day questions there. The link of our WhatsApp and Instagram will be in the description box. You can go, you can join via the invite link that I've posted in the description. Our next video will be posted on this Saturday on ACLS. Do check out that video. It is an important topic for the mains exam. Till then, like, share, subscribe and hit that bell icon and stay tuned with our channel.